Hello dear friends, welcome to Beloved Way. I did not sleep very well last night, so I woke up with a crick in my neck on the right side. So as I'm trying to heal myself, I thought maybe I should make a video about how I do using acupressure and massage and some exercise to help myself. So I hope it will help you or your loved ones in the future. Okay, so the first acupressure point is actually called the crick neck point. It's a special point. Okay, so you hold your fist slightly. It's between the second and third metacarpal bones, and you move proximal to the metacarpophalangeal joint about half an inch. So basically between these two, second, your pointing finger and your third finger, your middle finger, and then you go toward your body half an inch. So I'm going to draw it right here. So it is about here, this point here. So between the two bones, you go up here. And it doesn't have to be half an inch. You can just palpate it and see where is the most sore point. For me, it's right here, okay? So since I have the crick in my neck on the right side, I would do on my right hand. But just for the demonstration, it's easier for me to show the left hand. So if you have a left shoulder, crick neck here, you would do right here. And this is called the crick neck point, okay? So what you do is you press soft first and then harder and harder, harder. And at the same time, you try to rotate your neck. You try to rotate your neck until you can't do anymore. And then you release, okay? And then you do it again, gentle, medium, hard. You feel this soreness, okay? And then at the same time, you try to move your neck on the same side until you're able to rotate a little bit further back, okay? And then you try to do it again the third time. And hold, hold, hold. And then you rotate, your head go up and down, back and forth until you get a little bit more movement. So you would repeat this, maybe 3 or 5 times, but don't do too much because you may, if you push too hard, it may cause some swelling in here. So just use it as you will, okay? And the second point is small intestines 3 or Hoshi. This point is very easy to find. It's here in you see the crease here, the palmar crease. You go to the side, and here between the dark and white meat, right here in the border here. So right here in this point, okay, that's the SI3 or Hoshi. This point is pretty important. It is confluence point of all the governor channel, the due meridian. So here it helps with the neck and shoulder area. So what you do is you use this little the bone on the thumb, and you press on here, and it's very sore. You go rock back and forth. It is sore, I know. So you go back and forth, rocking motion while you do that, and you just move your head again up and down. I'm very sore, but I should be doing. You can do both hands, but I think the same side will work better, or you can do both sides because both sides would help. Okay, so you go. Just turn, okay? So here is a Hoshi, okay? That's a second point. The third point is very similar to the first point. It's on the Sanjiao meridian. It's between the 4th and 5th metacarpal bones. Between here and here, you go up again half an inch, and also you kind of just palpate until you feel a sore spot right here. It's 4th and 5th metacarpal bones, and here it's kind of sore. And what you do is you just push down, same exercise, okay, until you can move it a little bit, have more range of movements. Okay, so these are the 3 acupressure points that I want to go over. Okay, next one is I want to just show some massage technique to help this area. And this is more the proximal area. So a while ago, those are distal points. So now I'm going to show you the proximal points that you may help. So the first point is, if you can see here, right below my occipital bone to the side, if on my right side here, okay? So I would massage, use my fingers to massage here, find a sore spot, and just go back and forth. Here's really sore, okay? I go back and forth. This is actually in my fengci area, okay? So right below the occipital bone to the side, okay? This is the first point. The second point is close to the mastoid process, right here. And you basically massage downward until you see this band of muscles that's really tight. And you just go over it and just massage. And you can also put a warm compress or warm sock on this area and just massage. Usually when we have crick neck is because we are exposing to some coldness during the night. And our pillow isn't at the right position and there's some stagnation going on, blood stagnation, okay? The third point is at the bottom of between the bottom of our neck and shoulder right here, okay? So you would just massage here, okay? Just hold here, massage for maybe a minute in a rotating circle, and then you can move your neck and to see if your range of movement is better, okay? This is jianjing area, okay? And the fourth one is on the tip of your shoulder blade. So here's a shoulder blade on the inner points on the tip. And you can feel this, maybe some sound coming on or some just tightness. And you can massage that. So what I use is a lazy man. This is also called guasa. Okay, here you can purchase anywhere. This is a guasa ban. Okay, so you would put some like coconut oil or I like sesame oil. Oil it up so you don't hurt your skin too much. So you know what I do is I just gently go up and down and just scrape it gently right here and scrape my shoulder and back of my shoulder if I can reach it. I'm maybe with the other hand. Okay, so this is just an easier way of reaching, and you don't have to scrape too hard, and sometimes it will leave some kind of red mark or a little bit purplish. It's almost like when you do cupping and you will see the purplish, basically it's from blood stagnation, because if you have some coldness in your body, it brings it outwards, so expels some coldness. So this is what I do. You don't have to do that if you don't want to have some bruising. So just use your hand, that's a perfect tool, and just massage these 4 points. So that's what I do on self-massage. Finally, I just do some stretches. The easiest stretch I do is have my hand go backwards and hold it, just pull and hold it for 20 seconds. I count to 1,000, 2 1,000 to 20,000, and then I release, okay? So that's the first one. And the second one is do the chicken dance. Hold your hands on your waist and just go backwards. You know, the shoulder go backwards. Hold for 20 seconds and relax. Hold for 20 seconds and relax. The third one, just move your hands up and back. So the first one we did was just straight back. Now you go up and back and twist your hand inward. And then pull your head to the opposite side so you have this stretch, okay? So you can do the 20 seconds as well. Do 2 or 3 iterations. So that's what I do for my crick neck, and I hope I have it resolved by tomorrow or the day after. And I hope this video helps you in any way. And so again, all my videos are just, use just what I do, and it's not a recommendation, it's what you need to do, and you can see your TCM doctor or your physical therapist doctor for advice. Thank you again for watching, and I wish you well. Bye-bye.